Good morning, everyone. Welcome to my 3-month progress report presentation. My PhD topic is about the oral complications of type 2 diabetes mellitus. I'm Kata Haba. I'm from the Department of Prosthodontics. I'm a second-year resident there and also a first-year PhD student. My supervisors are Daniel Vég and Dora Haluska, and my SMS is Cindy. My vision is to improve the life quality of patients with diabetes, and my mission to this is to assess all the potential oral complications of diabetes and target them. For specific goals, I have 2 ongoing. I started both of them this autumn. Here you can see them, and I'd like to achieve them both through systematic reviews and meta-analysis. Let's jump to my first one, which is about the correlation between salivary glucose level and blood glucose level. My co-investigator for this project is Patrick Reuter. Diabetes mellitus is a chronic metabolic disorder which affects many organs in the human body, including the oral cavity. There are many million patients with DM who have to endure the inconvenience, pain, and cost of measuring their glucose level from blood sample. As it affects their life on a daily basis, my main research focuses on exploring a new method for detecting their glucose level, and a possible alternative way to do so is measuring their glucose level. Consequently, my clinical question is as follows: what's the relationship between salivary and blood glucose levels after fasting? We chose the PERT framework for that. My population is a general population. My index test is a saliva test, mainly focused on glucose oxidase method. My reference test is blood test, and the diagnosis of interest would be correlation. And my hypothesis is that the salivary glucose level matches with blood glucose level after fasting. And again, my clinical implication is to detect a new method for glucose level measuring. We did a systematic search in 4 databases, started on the 22nd of November this year, and here you can see my search key below, which was accepted by Marianne. And now I'd like to present you my 3 key articles. My first one has very well standardized measuring systems, well-described methods, and all the potential influencing factors are very well filtered. However, for the limitation, I have to mention the low number of patients included in the study and control groups as well, and is limited in patients' age. For the second, they did a pre-trial for standardizing their measuring system, which is very good in my opinion, and the representation of results is very well represented graphically, which helps me a lot to understand their interpretations. And they use varied methods for collections for blood and for salivary glucose levels also. For the limitations, they enrolled a low number of patients also, and the individual differences between patients are not filtered so well. And for my third one, they involved a big number of patients. The methods and the measuring systems are well standardized and described. However, the graphical implications of their results are insufficient, so it's a little bit harder to understand, but I'll do it. After we had our preliminary data extraction meeting with our statisticians, we extracted the individual patient data from articles, and we processed the data, which is illustrated on the scatter plot. As you can see, there are 6 data sets where each of them corresponds to a selected article, and the most recent ones show a linear relationship between blood glucose level and salivary glucose level, which implicates me that I'm on the right way with my search. Here we can see my flowchart of selection. We had about 11,000 articles before the duplication removal, after that around 9,000, and now I'm on the full text selection phase with my co-investigator. Here you can see my first topic project so far, and I did my full text selection, and I hope to jump for the data extraction part this week. Now see my second one, which is about evaluating oral hygiene and periodontal complications in patients with hyperglycemia. As I mentioned, I'd like to achieve it also through systematic review and meta-analysis. My co-investigator for this project is also Patrick Reuter. To investigate the link between periodontal health and hemoglobin A1C levels, which is an indicator for glycemic status, is crucial for enhancing diabetes management. On one hand, periodontal disease can impact the systemic health by potentially worsening diabetes control. On the other hand, controversially elevated hemoglobin A1C level might aggravate periodontal conditions. This shows me that a good oral hygiene can help patients with hyperglycemia to manage their diabetic status. So my aim is to show the need for regular oral checkups for hyperglycemic patients to integrate into their oral healthcare for managing diabetes. My clinical question for the second project would be, how does the abnormal hemoglobin A1C levels affect periodontal outcomes? We chose the PO framework for that, where population is a hyper and normoglycemic patients. Exposure would be hemoglobin A1C levels and outcomes would be periodontitis. We have our first meetings with the statisticians about this project, where we describe their main predictors, which would be hemoglobin A1C level. The additional predictor would be the duration and status of periodontitis and DM. And we have the response variables, which will be the pocket depth and clinical attachment and its loss. And my hypothesis is that the status of periodontitis is more severe in patients with higher hemoglobin A1C levels. And again, my clinical implication is to emphasize the importance of frequent dental checkups among patients with hyperglycemia. Here you can see my 3 key articles shows from this, for this topic. Each of them are from this year, which implicates me that it's a pretty hot topic, so I hope to investigate it as soon as possible. And for summary, I'd like to share with you my planned submission dates. Both of them are for next year, 2024, in May and in September. And I'd like to thank you for your attention by a quote from Louisa May Alcott from Little Women: "No good can come from doing nothing, as I'm not a fan of bystander effects." Thank you very much.
You mentioned this glucose oxidase method. Are you planning to include any other method or just this?
Thank you very much for your question. Yes, I'd like to. We chose the glucose oxidase method because, based on the literature, glucose oxidase is easier to interpret into biosensors. But yeah, we'd like to subgroup with other methods as well.
Can be glucose measured in saliva be as accurate as blood glucose?
As I saw it in the most recent publications, yes, because the sensitivity of the newest diagnostic kits are much better than before. So yeah, I hope that it's possible.
Why did you choose the general population in the PICO framework?
Thank you for your question. Later on with this project, we'd like to go with a lookup table for clinicians to detect the abnormal glucose levels based on saliva glucose levels. And therefore, I'd like to use a wider range with patients from control groups and study groups as well.
How did you get the raw data? Because you had this feature with the plots on it.
I have a really good statistician, Gergő, and he helped me a lot to extract the individual patients' data from articles, and he helped me how to interpret it into a scatter plot.
From the graphs?
Yes, from the graphs.
Okay.
And from charts, if
that's
it
very
was
tedious work. So it's a lot of work if you have several studies. That is good. And that's related. My question is but this was a bivariate correlation, so you have just one X and one Y. But is there any co-founder which could be like doing multiply regression instead of correlation?
Yeah, we will investigate it, but as I said, it was only a preliminary data extraction, so we have to go deep further.
Thank you very much. And
thank you.